The tool of 5 whys can be used to clarify a problem. Initially, the Kaizen team grouped together many things that the staff had relayed under the heading of understaffed clinic. The outside group facilitator, Justin, cautioned them against using a problem that was really more a statement of cause. The group revised the problem based on the input from customers and staff that nearly all providers were nearly always running late. The real problem becomes then staff working through lunch, going home late, patients waiting extended times during their visit. The Kaizen team then took their problem statement of the clinic running behind schedule and asked a series of questions then, looking at causation. The simple question is why? And this question should be asked multiple times to get to a root of the problem that can be addressed. For any given ask of why, you could have multiple answers, but the team needs to select one and move on with it. When the team asked why the clinic was always running behind schedule, the answer was not so much directly related to the staffing, so much as the patient flow. So why is the clinic always running behind schedule? Because it takes too long for each individual patient to get through their visit. The next why is more complex. So why does it take too long for each individual patient to get through their visit? Well, most clinic visits are fairly straightforward and should have a reasonable workflow and not take that much time. But some patient visits will take longer time. And even those patients with the more straightforward visits, when they come at the same time or after the patients who take longer, will end up delayed. So delays compound themselves throughout the day. So why does each individual patient take so long? Here's where whys will diverge. One answer to the question is simply that all patients are scheduled for the same amount of time for their visits, regardless of their expected needs. Another approach may be that too many patients with complexity are scheduled at the same times, and in particular early in the day. The Kaizen team has to make a choice here about which of these two potentially legitimate reasons they want to pursue in the next why. Well, which is more significant? They probably both are, but since the issue of time of visit would affect every patient, the team chose to use this as their next question. So, why is every patient scheduled for the same amount of time regardless of their anticipated need? Note that this is the 5th why. That doesn't mean you're done asking why. 5 is a convenient number of times to ask the question and usually leads to a satisfactory result. But if 1 or 2 whys answer the question, there's no need to continue. Or if it takes 7 or 8, that's reasonable. Continue asking why. So every patient is scheduled for the same amount of time because that decreases the complexity of scheduling patients for both the electronic practice management system, which is tied to the electronic health record, and for the front office staff who do not have medical expertise and would be imprecise if they were attempt to schedule a different number of lengths of appointment times. So in this case, one could ask further why questions, or one could directly address the two-pronged response of the front office staff training and practice management software programming. This is also an area where a subject matter expert may be helpful to facilitate. This should be anticipated when scheduling or planning a Kaizen event. As it happens, the outside facilitator that was brought in was such a subject matter expert. And in the next video, we'll talk about what they did next.